Singers, we're so excited to have this live YouTube video, YouTube Live with Dr. Tyler Nelson. Dr. Nelson is an amazing tenor soloist, and we are so fortunate to have him, his expertise, and just his fun personality on our channel today. So I just want to give a little bit of background for him so that you might know him a little bit better. So he has sung all genres of music. He's a classically trained tenor, but he's sung Broadway shows and everything from every genre. It's really fun to see him switch styles. He and his wife are both amazing singers. And so if you get on YouTube, you can hear them sing a duet here and there. And I'll talk about that more in just a moment. But Dr. Nelson has performed all over the world. He's been on the opera stage, like I say, the musical theater stage. And we've known each other since the early 2000s. We both went to the University of Utah together in Salt Lake City. And then later on, we just ended up at Florida State together in Tallahassee, Florida, where he did his doctorate in vocal performance, and I did mine in music education and conducting. Just delightful people. We actually lived in the same apartment complex, and they had kids a little later than us, so they would come and help take care of our children. It was really fun. You know, you might want to check out in the link in the description below some of their YouTube videos. He and his family, they have 3 beautiful children, and they've done some really fun parodies on pop songs recently, playing on the pandemic right now, but you will get a great kick out of them. And you can see those links. Dr. Nelson also has a blog and has other social media resources for good, reliable information on becoming a great singer. And so I hope that you'll check some of his things out below. So Tyler, welcome to the show. So glad to have you on today.
It's so good to be here. Thanks so much for having me.
So exciting. I thought since this YouTube channel has a lot of opportunities for people to do warm-ups, if you would like to lead us in a vocal warm-up, you know, a short something people could come back to at the beginning of this video and practice with, and something a little different than maybe I've done. And I know there are similarities, but whatever you want to do, let's go for it.
Fantastic. Well, I love that you said there are similarities. I mean, I think healthy things are healthy things. So even if presented in a slightly different way, if it's good, healthy vocal technique, hopefully we're all getting our way to that same thing. So it may sound like different language, but you may think, oh yeah, I've done this before. And you probably have. So I love a set of warm-ups that you can kind of compile into one category called the partial occlusion exercises. And by that, I mean something is partially occluded or closed, for those of you that may not recognize that term. So the thing I love about these is you can do them when you're not warmed up at all to start getting your voice going, or if you've done a lot of talking or singing that day and you want to just kind of tune things up again. They're great for singers of any age because they're the most, I think, safe exercises to avoid hurting yourself or doing any sort of vocal damage, getting into bad habits. And they're really great ways to explore your range without, again, doing anything that could be dangerous or harmful. So I'll just take you through a few of these and see if any of them stick, see if any of them feel good to you. These should be very fun, very friendly, very comfortable things that you can do without worrying about damage or bad habits. So, okay, you've all probably heard the just the regular lip buzz. This is one that's always good. And I like to think of the lip buzz, though, with one slight addition to do it with a vowel inside. Imagine a vowel inside. I think sometimes we sing generically, we do generic things and we get generic results. And we're not really happy with them. So if you can be specific when you're singing, very specific things tend to produce really specific results. So I'm going to think of an E in the back when I do my buzz. So that's going to sound like this. I'm going to go... You can hear the difference. If I don't have an E in the back, I go... It's a lot airier. I have a hard time even keeping the lip buzz going sometimes. The air pressure's not great. So, yeah, picture a vowel in the back, whatever vowel you choose, and let's just go through a couple of these and explore a little bit. So we'll go descending. Here we go, ready, and... everybody now. So very simple exercise. You should feel your lips buzzing easily and consistently and naturally. If you find the lip buzz is intermittent or that it feels really pressurized or perhaps extremely fast or really slow, that probably indicates some tension somewhere, either in the jaw or down in this region or perhaps the back of the tongue. The lip buzz, the buzz will be a great indicator for you to tell you if you're doing the right things inside. So let it be sort of a canary in the coal mine thing to let you know, okay, I'm lined up. There's an even, smooth, consistent buzz, or no buzz. I'm tensing somewhere if that's happening, or I can't even get that to buzz, but it sounds different. That's probably too dark or too open. So all those things help us to adjust. Okay, so apply those same rules. Let's take that to another exercise. Let's do a rolled R. Some of you can't roll your R's. It's okay. If you've got a Wookiee sound, that's great. That's also partial occlusion. So, let's leave the Star Wars fans. Let's make sure they're part of this too. Okay, so here we go. Rolled R. Same thing. Put a vowel in the back. Be specific. So we're going to switch our direction here. We're going to go from bottom to top. So we're going to go... Just like that. So again, we're listening for even, smooth exchange and roll. We're trying to make sure that we don't hear interruptions in the sound, and you shouldn't feel tense. You should feel very relaxed. It should feel like you're not doing anything. And if that's the case, you're doing it right. If you feel like you're working really hard, you're probably doing too much. In this family of exercises...
Can I ask you a quick question here?
Please. Yeah.
So how do you know how high you should go? Obviously, when any of us sing too high, it sounds pretty awful. Is that okay to sound awful when you sing high?
Yes.
Awful is relative, but...
Right. Yeah. No, I love that question. That's such a great question, Roger, if I could speak English. Just learning here. It's such a great question because so many times we don't experiment with our high range. And then we all do this, right? We get into the practice room or we get into rehearsal and we scream those notes as loudly and as forcefully as possible and hope for the best. It's the cross, your fingers and close your eyes and hope for the best principle, which never works out. So when you're experimenting with that high range, you've got to make trips up there in a healthy way to figure out what's going on and to discover it. Don't be afraid to make ugly sounds. Thank you so much for making that point, because this is the exercise to make ugly sounds on. Do that lip buzz right up to the top. Make the most terrible sound you've ever heard. If you're buzzing well, you're probably not going to hurt yourself. Now, I say that because there's always someone who will find a way, right? We can hurt ourselves anywhere, so don't try to. But with a hum or a buzz or an or a rolled R, these are the exercises to test out that high range. How far can you stretch up there? And it should feel kind of like a muscle stretching. Remember what your vocal cords are doing on the top. They're going like this. They're stretching. They're getting thinner and they're getting longer. So unlike a piano, which is on the bottom is longer strings and thicker, our voices get longer, our vocal muscles, but they get thinner. So you are stretching, and you should feel that movement and that slight sensation of tilting. This is a great way to experience what it feels like to sing up into the top of your range, but not in full voice and not at a fortissimo dynamic, singing as loudly as possible. Do it in a natural, what feels like a natural spoken, level dynamic, and just make noise up there. We've got to be curious. We've got to just be willing to make ugly sounds and weird sounds, as long as they're not hurting. It may feel new, may feel uncomfortable, may feel new and weird, but it shouldn't feel uncomfortable. This is one of my favorite tricks when I'm learning a new aria or an aria that's particularly hard, that sits up in the top part of the voice. I never let myself sing through it with all the text and all the notes in tempo before I've done this kind of stuff on top. Otherwise, I get into bad habits immediately, or I just get tired really fast because I don't know what I'm doing. I'm trying to synthesize too many things at once, such an important part. Thank you so much for that. Yeah. In this family of exercises, if you want to play around with these and they feel pretty good, you've got your lip buzz, you've got your rolled R, you've got the sound. That's a great one too. That one works really well to take up to the top and then open up to a vowel. I just posted an exercise about this a couple days ago. This is a great way to experience those top notes without all the pressure. We do need to test them full voice eventually. You've got to see what's happening, but you don't want to sing them repeatedly full voice over and over and over. Let's see what else. Well, for those of you familiar with the name Ingo Tietze, a brilliant, brilliant vocal scientist, he has an excellent exercise on YouTube that's just called the straw exercise. I'll have to look it up again and get this to Dr. Hale if he doesn't already have it. But you sing through a straw. You close your mouth over the straw, and it helps to do the very same thing. It decreases the subglottal pressure. It helps you sing more easily. It helps you focus the tone and the sound. And it's a very simple exercise. For my part, I like those big drinking straws. McDonald's, I think, has these. They're ideal for this. So, go grab an ice water or a soda from McDonald's and use the straw. I usually keep a bundle of straws in my drawer at school, and sometimes I'll have students sing through their entire warm-up or to sing through a part of a piece with the straw. It helps to keep your larynx low, keep everything relaxed, and again, experiment with different parts of your range without bringing all the weight and all the tension into the sound.
Could you describe or just give a brief definition of what subglottal pressure is, just for those that don't know that term?
Great. So yes, housed right here in the vocal mechanism and the vocal tract are your vocal folds. And we call that sometimes the glottis. So when we sing, that is closing and opening at a really rapid rate. Sometimes thousands of times per second. So the higher the note, the faster it's vibrating. It's incredible what this body is doing as we're singing. No wonder it's so hard to learn how to sing. You're synthesizing so many things. So the glottis, when it's closed, for example, air is coming up from underneath it, and as that valve is closed, it truly is a valve, pressure builds up, and that's what helps to facilitate us making sound. So if you hold it, for example, if you take a breath as if you're in a conversation on the phone and you go, and you stop it, that's your glottis stopping the airflow, and it builds up pressure. Now, if you keep pushing hard, that pressure will rise. So as we sing, there's a certain amount of pressure that's useful. We need that exchange of air. It releases and it builds, and that's what gives our folds that great oscillation or that great exchange. Vibrato or spin in the voice is sometimes is called. If we have too much of that, it can cause undue strain on these very sensitive and very tiny, precise muscles. And you can do damage. You can actually, well, we won't get into that, but you can do a lot of damage. Things that are sometimes not able to be reversed or require surgery or a lot of vocal rest. So we need to be aware of how much subglottal pressure or pressure below the glottis that we are allowing to be part of our singing production. Because it can really make a difference in how long you're able to sing, your stamina, how well you're able to access different parts of your range, how much flexibility and mobility you have. A general rule of thumb is most of us speak in a really healthy way, encore. So if I'm speaking with too much air and I add that amount of air, I'm overproducing. There's too much air in that sound. If I'm under supporting, I'm having to close my glottis tighter to artificially produce that sound. That's under supported. We want a nice, even, balanced exchange of air. We shouldn't feel like we're working to produce the sound, but there's still core. There's core in that sound. So we avoid an overabundance of the subglottal pressure and therefore put undue strain on that really important valve down there that starts the whole process. At the source, if you were to scope down your throat, you'd just hear, it sounds kind of like a weird sort of a buzz, almost like a duck call. From here on up, that's where the sound is created, really, and shaped and modified, which is pretty miraculous when you think about it, that it all starts right there with the buzz. So
now that was an excellent description of subglottal pressure. Thank you so much. So now go back to that straw exercise, and when you're closed like that, you say you can sing it without the subglottal pressure to keep things flowing a little easier as therapy, as relaxation, all that stuff, right?
Yes, this brilliant work that our vocal therapists do and our speech pathologists are able to help singers, correct certain things in their speech patterns that are causing them stress, or some folks that have suffered from a hoarse voice or get really tired really quickly. These are types of alignment exercises. One of the things this straw exercise addresses is it helps to keep the larynx at singing level, a lower level. If your larynx is high, it's not really conducive to singing or speaking. As you can hear, if I let my larynx go higher, all of a sudden I put a lot of strain here, things get tight, I'm working way harder than I should be to produce sound. The straw, and you can even replicate it right now, you can close your lips, imagine a drinking straw. It helps to elongate feels like it elongates that vocal tract, puts it in the right shape. So it's almost like we're correcting the posture of the vocal tract. Yeah. And then it also helps that larynx to get down to a more singer-friendly position so it doesn't ride high. It's so critical that all these muscles know their job and they're in the right positions. The trick of it, one of the tricks, is that we can't feel most of these muscles and we can't directly control them. We can feel things that happen when they're in the right place, and we can address them through muscles that we can feel or processes that we can feel. But a lot of times we're having to just simply listen to our sound and make those corrections from an external point of view. And this is where our choral directors come into play. I mean, those of you who have sung in a choir know that our choral directors have the most killer set of ears on the planet. They can pinpoint in a section one lone voice and say, something's off there, you know, and they can make those corrections, whether it be a vowel change or a posture change or things like that. I mean, these ears that you have to train as choral directors, for example, have to be so attuned to that sort of thing. And conductors as well, of course, those instrumental conductors with instruments. And obviously there are many conductors that do both, and opera and choirs and orchestras, all of that. But those ears have to be so attuned to that external manifestation of an inward adjustment, since we can't see most of what we're doing on a regular basis. So,
excellent. Thank you so much for that. As we move forward here, I felt like those exercises are really wonderful. You know, maybe talk about the importance of breathing a little bit and how, and you did a little bit with the, with the pressure and things, but how important is it to keep a breath moving as a singer, a choral singer or a solo singer?
Yeah, it's critical. I mean, if you don't have a good, solid, steady breath pressure or breath support, rather, you're not going to be able to make a healthy sound, period. You've got to have enough fuel, as I call it, coming through the tank. I always, with my students, they get so sick of this, but it makes sense to me, so I keep trying. I always relate it to a car. You can have that engine on, but if there's no gas in the tank, and even if it starts, if there's no gas in the tank, you're not going anywhere. You can have a beautiful, pristine machine that is finely tuned and is the state of the art and leather interior and whatever else you want. You know, the most beautiful sports car on the planet. If there's no gas in that tank, it's not moving. You know, it's not moving by itself. So you've got to make sure there is movement, there is air flowing at all times. That is your fuel. And you need to be consuming or using that fuel on a regular basis. You're going to be constantly adjusting the amount of fuel or air coming through the sound, because as I was just demonstrating a minute ago, you can have an overabundance of air or a breathy tone. You can also have a breathy tone on the other end of the spectrum. So you can under support with the air and you can over support. Our goal as singers is to try to find the balance, the right amount of air that yields the best sound with the least amount of effort, if that makes sense.
Might you be able to just demonstrate that spectrum a little bit for us, just on an open vowel? You know,
sure.
An aspirate sound, a more tense sound, and maybe the ideal balanced sound.
Sure, great, yeah. Okay, so for example, if I'm over supporting, if I'm using way too much air, I get as you can hear, there's no stability to the tone. The vibrato is all over the place. It doesn't hurt. It's not really expensive, especially in the middle part of my range. And so I'm not really spending any vocal capital, but I'm sure not producing a sound that's projecting. That's not going to go very far. My air tank is immediately depleted because I've, in essence, got an air leak. You know, there's an air leak in my vowel, so it's just leaking air. It could be a decent vowel, but who knows really, because there's so much air masking the core of the sound. So that's too open here. So I've got the right idea with an open vocal tract and release in the mechanism, in the way I'm trying to produce the sound, but I've got way too much air in the sound. Let's see if I can do something on the other end of the spectrum. That same note, that same pitch. I'm on A major, so if you're following along and trying this at home, if I go, so the breathy one, so I can almost get a core sound out of that, but you can probably see how much I'm flexing here. So I'm basically trying to manipulate what's happening with this mechanism that should not be working that hard. I'm trying to supplement for the lack of air support. So my body says, okay, you want an on an A major here. You're not giving me enough air to do that. I guess I'm going to have to tense the vocal mechanism here, the chords. I'm going to have to pull them in a weird way to raise the pressure to the point where you can make the sound you're asking me to make with the little bit of air I'm getting. So since you're not giving me enough, we're going to find another way to do it. Our bodies are resilient. they will find a way most of the time to do what we ask them, even if we're not giving them what they need. So you find this out at home when you don't sleep enough, but you still have to work a full day. So we just get through it. We do it. And we do this so many times in singing, and we think, gosh, I'm really tired after that rehearsal. Or, man, I just can't figure out why I can't get to the end of that phrase, or why it's really hard for me to negotiate this particular interval. A lot of times it's because the air supply is not quite right. It's not sufficient to the needs of what we're singing. So hopefully in the middle of that is, and let me try to adjust on the other end. I'll give you too much air and too little. I'm purposefully using a really tall vowel so I can move between those. That may be something that's a little too tall to project ideally. And you can change those little factors back here. Those are our resonance tuning. But hopefully you can hear the difference in the quality of sound in those different positions. And it feels different. The airy one feels like I'm about to yawn. And we don't really want that sensation as we're singing. We want something that is right before a yawn, maybe. The pre-yawn, that's good. And the other one feels like you're about to swallow almost. Feels like just before you swallow. Funny enough, the body is designed to do that naturally. As you swallow, the epiglottis is going to come over and cover the passageway to the lungs, right? So you don't get food or water going down your lungs. And the larynx is going to raise. Things constrict naturally as we swallow. That's built into us. That's part of, the way our body works naturally. By design, we don't want things to go down into our lungs. That's no good. We want food and water to go down into our stomach. So the epiglottis covers one of those openings so that we don't get things going down the wrong tube, so to say, if you've ever used that expression. However, that is something we have to fight during singing, because this feels a whole lot like, it feels a whole lot like you're about to eat something or take a drink. So your body goes, oh, here, okay, we're going to swallow. We're about to swallow. So it prepares for that. The larynx raises and things start to constrict. We have to fight that as we're singing because, of course, we don't want things to be tight. All that, though, will influence the amount of airflow coming through that tiny little valve down there on the bottom. So it's really critical that we learn how to relax those mechanisms. And to circle back, that's why these partial occlusion exercises are so fantastic, because you can experiment with that and feel what's happening. Take inventory. Okay, I get this sound when I have this sensation. Okay. You can hear a breathy sound in the buzz, too. You can go... Yeah. I mean, you can hear the difference. One of those projects even through a buzz. So you can definitely test all of these things out with the comfort of that little bit of a safety net in front. So is that what you were getting at, Dr. Hale?
Yes. Yeah,
okay.
That's perfect. Thank you so much.
Yeah.
So I feel like we've done some good practical exercises here at the beginning. We've talked and connected, and I would like to do that a little bit more. But can you talk a little bit about hydration? Because I know that's very, very connected with a healthy singing voice. Yes.
This is such an important thing. Hydration is a seemingly simple thing, but it's one that we often neglect because it seems so simple. I think a multitude of vocal trouble can be fixed with proper hydration. So let me just talk you through the basics. These are the things that I think about as a singer. Number one, you have to be hydrating days before. You need to be hydrated. So in other words, if I have a big performance tomorrow, it's too late to start drinking a ton of water right now and hope that I will be fully hydrated by tomorrow. Will it help? Yes, it will. Will it be better than it would have had I not had any water today or extra water? Yeah. But I'd say give it 2 days, 2 full days probably before your target day that you want to be hydrated. The beautiful thing is once you're hydrated, my personal opinion, you can stay hydrated and maintain it. And it's much easier to do that as opposed to deplete a dehydrated body over the course of a few days than try to sing on tired and dehydrated chords. So start a couple days before. Don't start the day of. A lot of singers will bring water bottles up with them into an audition. Now, if you've got a lot of gunk in your throat that day, or your mouth feels really dry because you're nervous, and a swig of water will help, okay, cool. But if you're hoping to hydrate there on the stage in the audition, it's too late, my friends. You're a couple days too late. You need to be doing that work before. You should be able to walk into that audition feeling hydrated. Yes, we have nerves, and those things always play funny tricks on our body, but hydration needs to happen far in advance. This is gross, but if you're not peeing clear, you're probably not hydrated. So you should be monitoring that, and you should be peeing clear on a regular basis. If you're truly hydrated and you're maintaining it, then you're in good shape. So just keep an eye on that. and make sure that you are taking inventory. As far as what to drink, how to stay hydrated the best, there are a lot of theories out there. As with anything, I would say, if I can lump Dr. Hale into this here, you have to take everything on an individual basis. There is not any universal solution for everybody. Some folks can drink a certain thing and feel just fine, and others can't touch it. They feel terrible when they drink a certain thing. So that all needs to be a very personal thing. But I can say universally, water is hands down the best thing to drink. Plain old water. Nothing in it, no carbonation. Some recent studies suggest that carbonated and non-carbonated water will equally hydrate. They're equally effective. Some people really feel that plain old water is the only thing that feels right. Sometimes the carbonation will bug people. It can create issues if you deal with acid reflux or anything like that, any stomach issues. The carbonation can make that worse or can exacerbate a problem. So there is no argument, though, about good old plain water. That is the best thing. It's just the best thing to hydrate with. So had recently an interesting conversation with my ENT about smart water, which contains electrolytes. And I wasn't really buying into all the hype. I just thought, okay, this is just a way to charge double, triple for water. But she suggested that the electrolytes do help the transfer of the water into our tissues more efficiently and more quickly. And so I tested it out. I did an experiment when I was down singing Barbara Seville in Tampa with Opera Tampa. And I decided to switch to smart water for that particular engagement and see if I noticed any difference. So I'd just come off a gig and I was feeling good. I was feeling a good vocal health. And I started drinking only smart water. Costco and Sam's Club sometimes sells it at a decent price. So you can try this experiment out without breaking the bank. But I noticed a difference personally. I felt like it helped me to deal with the allergies that I was battling down there. And I did feel like it hydrated a little more efficiently than just regular water. So that's been my experience. I know some singers feel no difference, but things with electrolytes, and I'm talking just electrolytes, not any added flavoring or coloring. You do have to watch out for those things. They can cause problems, again, in terms of acid reflux. So I'm talking plain old water or smart water with electrolytes, but no added flavors or colors. So those are the big bullet points.
Excellent. So you mentioned an ENT, and we've got people on this video that are coming from different different nations, speaking different languages. So maybe talk about what an ENT is and what benefits they can have for somebody that visits one that's a singer.
Yeah. So, I mean, just as there are specialists in every single field, for singers, your ENT is going to be your specialist. Otolaryngology, these are the people that are in that field of study. They're going to be
ENT means ear, nose, throat.
Oh, sorry.
Right?
Thank you.
No, that's good.
I'm throwing out otolaryngology instead of saying ear, nose, throat. Yeah. This is why Dr. Hale is in charge. So, yeah.
Because I speak simple terms. That's all I can comprehend. So.
Yes. No, I am with you. I am with you. That is important. And for the longest time as a singer coming up, I had no idea what that stood for. I just knew it was ENT, not EMT or any other version of that, but that's where you went. That was the voice person.
Right.
So,
okay.
Yeah. So ear, nose, throat. Thank you. And these are going to be the doctors that are going to help us take a really close look at anything related, to, well, for us as singers, anything that may influence or affect our ability to sing well. So, of course, that's the ears. That's this area, the throat. And, of course, the nose and anything in here, all that's connected. That's sort of part of our instrument. Our whole body really is our instrument, but they may need to look for blockages. They may need to test our hearing. They may need to take a look at the way our vocal cords are coming together and the way they're adducting or closing or abducting or separating. So it's really important that we have an idea of what's going on, what a baseline healthy, exchange for our vocal cords is. And when something's wrong, if you have that baseline picture, then you'll better be able to assess what may be going on. So, for example, when I first moved down here to Nashville to start my job at Vanderbilt here at the Blair School, and of course the allergies kicked up, and I felt them taking a toll on my voice, and I thought, oh, here we go. And it takes time to acclimate. Every new climate is going to give you challenges. You may come from a place and you think you don't have allergies and go to a new place and everything's busted. So yeah, went into my ENT and she said, okay, I'm not comfortable actually, prescribing anything or making a really, specific assessment here until I have a baseline of your vocal cords. So why don't you come back and we're going to scope you And for those of you not familiar with this, this is where they stick a fiber optic camera down your throat. Sometimes they go through the nasal passage in this way, and other times they take a big long scope and they go right in through your mouth, and they can see what's going on with the vocal cords. And they see how they're coming together. They can take a picture. It's really fascinating, actually. They put it up on the screen so you can watch as they're scoping you. They have you sing a little bit as much as you can with tubes and scopes in your throat. And you can see how the cords are functioning. You can see all those control mechanisms that are helping the cords to close and to lengthen and to shorten. And they give you a good read on what's happening right now. So when I got my baseline, I was dealing with a lot of allergies, and so my ENT said, you got a lot of phlegm down there, more than I would say is normal for the average person. Is this a pretty normal day for you? And I said, yeah, it is, unfortunately. She said, okay. So we had a really long conversation about what that does for my voice. It makes it harder to sing because all that phlegm gets in the way of your cords vibrating together, so it can make you tired faster. And so we went through some various options. She sent me to an allergist because she recommended that that would be the best course of action so they can assess what I'm allergic to. But then, in the meantime, she said, I would recommend smart water. Keep hydrating like crazy. There's nothing fancy that we can do here. The cords are coming together well. They're closing well. So they're forming good closure. Everything surrounding the vocal cords looks healthy, looks good. And then she gave me a video and some HD snapshots of my vocal mechanisms. So I had those as a reference, and I use those in my pedagogy class when I teach vocal pedagogy, the study of voice and teaching voice. And I'm able to look at those. And when I go back into her office, she can compare what she's seeing that day with what happened before when I was, in healthy shape. And it's really useful. So it's good to go in for a yearly scope or every few years just to see what things look like so you can track any problems that may be appearing, or just like anything, like your yearly physical checkup. If you're a singer, this is not a bad idea. They can be expensive depending on what kind of insurance you have, but I do recommend them for any serious singer. I think it's really important to know what's happening down there so you can avoid any health problems in the long term. So, yeah.
Excellent. Thank you so much. So, can you talk a little bit about sleep? How important is sleep to being a healthy singer?
Yeah, sleep is another one that's critical. I mean, obviously, as musicians, we have terrible schedules as far as sleep goes. We're often up really early and out very late at rehearsals. We're using our voices and our bodies constantly. And again, this is for all of us, conductors and those that are on stage in opera or musical theater productions, those in choirs. We are working. We're using our bodies, and one of the best things you can do to keep yourself in good vocal health and good shape, mentally and physically, is get enough sleep. And the standard recommended 7 to 8 hours is still what I'm reading is recommended, which is kind of laughable for those of us who have anything going on in life. Recently, I read a study that was pretty fascinating also about when you sleep. And this study suggested, I've got to look and see if I can find others like it because I found it really fascinating. They suggest that you should be in your REM sleep, your deepest sleep, before midnight, to achieve the most restful hours of sleep, which would occur sometime between 12 and 4. So some folks will go to bed really late, 1 or 2 in the morning, and then sleep that 7 or 8 hours because your schedule will allow you to. But if any of you have found that just doesn't feel quite as restful as when you go to bed earlier, there may be a reason for that. So again, it's almost impossible to do this for those of us that are in productions and rehearsals and shows and concerts. When do you get to bed before 11 or 11:30? But that recommended 7 to 8 hours sleep is essential. You've got to rest those vocal cords. You've got to give them a chance to turn off and stop talking and stop vibrating. What we do as singers is, and when we're speaking, can be very abrasive on the vocal cords. When you're tired, it intensifies the toll that it takes on your vocal mechanism. So, for example, if I'm singing something that's really difficult in a rehearsal and I'm tired, I'm going to be recruiting other muscle groups to help me sing those things because my vocal cords are too tired. They're small. They're tiny, precise instruments. They're not meant for heavy lifting. That's going to be your larger muscle groups. I mean, these vocal cords are not meant for that kind of work. So if you're going consistently exhausted to rehearsals, or you're practicing and you're really, really tired, you're going to get into bad habits without a doubt, because you'll be trying to manipulate or compensate in other areas because your mechanism, your vocal process, all this stuff that happens down here is not working at full function, at full capacity. So if you can't get the 7 or 8 hours sleep, try to get to bed early. Hydration will help a lot of that. The combination of hydration and sleep will keep you afloat. But sleep is also like hydration. You need to be sleeping regularly and in that rhythm and getting consistent sleep in order to achieve, maximum benefit. And probably immediately some of you are saying, yeah, but I know some singers that function on pretty much zero sleep. They are out there. I know some of them too, and I'm very jealous. I can think of a number of them that come to mind that can work on no sleep, 2 hours sleep. They can be flying all across the globe and work at high levels consistently. And I don't know how they do it. I honestly don't know how they do it. But most of us mortals, we need that 7 or 8 hours sleep. It serves many purposes, not only for mental health, but also just to give those vocal cords a true chance to stop, to rest, give your body a chance to rest, and simple things, right? I mean, there is no miracle cure for all of this stuff. And your ENT, that ear, nose, and throat doctor, they'll tell you the same thing. They'll say, well, are you sleeping well and are you hydrating? And you'll say, no, you're supposed to give me a magic pill that makes all this go away.
That's right.
That's usually called a steroid, and it's not very safe to take on a regular basis. So for those of you that are not familiar with steroids that we sometimes use, either, to reduce swelling or something like that, that's exactly what happens sometimes for, voices, is when they become swollen, sometimes a doctor will prescribe a steroid. And they can be very dangerous. If you sing while on a steroid, you can do permanent damage. So it's best handled with good old-fashioned and boring sleep and hydration, unfortunately. So not exciting. Sorry.
Well, so we're talking on this same topic. Let's talk a little bit about diet. I know I personally have suffered from acid reflux for a long time. I know quite a few singers in my choir that do, and there can be some serious damage that happens if it's not caught early on. What are some ways you can tell, as a singer, that they probably ought to go see an ENT and get it checked out, or what can they do?
This is such a great question. I personally think because of the stress levels as a musician, and simply because a lot of people deal with this but don't think anything of it, the average person may not even notice that they're dealing with acid reflux. And I'm talking different than heartburn. Heartburn, you eat too many hot dogs at a 4th of July picnic, heartburn, okay? But acid reflux is, I'm talking about where acid comes up and burns the bottom of the vocal tract as you're sleeping. You won't feel it. We don't have pain receptors down in this area. That's so you can actually eat food without gagging. We don't have, feeling down in some part of this so that you can move that food down to the stomach. And while you're sleeping, that acid can come up, if there's an overabundance of it, burn the bottom of that vocal tract and cause some real distress for you as a singer. Like I said, if you're not a singer or you're not using your voice on a regular basis, you may never notice. You may never feel any sort of problem. Things that you may notice, though, if you pay attention to them, you may constantly be hoarse. You may find that your voice is hoarse for no reason, even if you haven't been yelling or doing anything really strenuous. You may have an overabundance of mucus or phlegm. That's that really sticky stuff that, when you're sick, it can be, this is gross, but it can be different colors based on what you're dealing with. It may be an infection, or it may just be an overabundance of phlegm or mucus. That sometimes is a sign, apart from allergies, that you're dealing with some acid reflux. You may have a sensation of like a lump in your throat. Like when you swallow, it feels like something's stuck there. And you feel like just this persistent sense of swelling, or like something stuck down there. You may have a sore throat. You may be coughing or wheezing a lot for no apparent reason. You're not choking on anything, but you'll just start random fits of coughing, things like that. You will have what we call post-nasal drip often with this. So this is where, if you follow your nasal passage, just sniff in air, where it hits the back here, the back part of the nose, that opens up and will drip down to your vocal tract. So it can actually drip down and agitate your vocal cords and surrounding muscles, because that mucus that comes from your nose, that's designed to be there, but it can become really persistent and drip down if you're dealing with acid reflux and further agitate the vocal cords. So be aware of that sort of thing. I think those are probably trouble sleeping. You may wake up at night for no apparent reason. You may feel fine, but just keep waking up. Sometimes an overly dry throat, things like that. To pivot quickly, if you are singing, you may notice some other specific things. For example, it may take you a really long time to warm up. So some singers will tell me, yeah, I start warming up in the middle of the morning, and by the middle of the day, I still don't feel warm. It feels like I'm still really gunky or like I've just woken up. If it's taking a long time for you to warm up, hours, for example, or throughout the day, that may be a sign that you're dealing with some of this as well. Um, a good effective warm up, 15 to 20 minutes, depending on your voice, of course, right? This is all dependent on our individual instruments. But yeah, you should feel like you're ready to sing anywhere from 15 to 30 minutes for sure. Sometimes you sing for 10 minutes and you feel ready. But if you're finding you have multiple warm ups or you're not feeling warm even near the end of the day, or finally by the end of the day you feel normal and it's taken all day to get there, it's probably a sign you're dealing with some of this. Let's see, what else? I'm trying to think. Let's see. Oh, let me go to, yeah. And please interrupt, Dr. Hale, if there's something you want to add here.
Well, I was just, I think that you've covered this topic really well. And I think each singer just really needs to be aware of how they feel.
Yeah.
And, both Dr. Nelson and myself, it's funny, my son said, you have a PhD. Does that mean you're a physical health doctor? I said, no, that's not what PhD means. Okay. We're not here to give medical diagnoses. There are specialists that do that.
Yes.
But we have felt the effects of these things, and we've heard lots of voices that have been affected. So recognizing some of the symptoms of these things, we could say, oh, that sounds a little questionable. Let's send you to someone that knows.
Right. That's right. That's such a good point. Because often we want to help singers and we want to make sure that we get them into good singing shape immediately. But our training is very specific training, as is the training for the ENTs. So it's almost impossible, nor should we try to diagnose somebody in a vocal studio. We can say, I'm hearing these things, like you say, I think it may be this. Let's go get that checked out. I've had students before that I've said, I think something's wrong. Let's go get you scoped. And they've gone to be scoped. Nothing's wrong. But then from my perspective as a teacher, that really helps me to know how to better address their issues, because I can move forward with confidence knowing that there's not some sort of like a polyp or a node on the vocal cords. This is where the vocal cords can develop a little, almost like a callus, like you get on your hand or your finger, and it prevents the vocal cords from closing fully. That can happen to singers for a variety of reasons. But for example, if somebody had one of those, I can't see that. I can guess that they might have one. But if they go into the ENT and there's no evidence of that and things look really good, okay, we can move forward knowing that the technique that we're going to use, can work to address the issues. If somebody has a node or a polyp, we can still address that in a vocal lesson, but it's going to be a slightly different version of vocal technique to make sure that we treat it in such a way that we can get those polyps to go away and those calluses to go away. The recommended treatment now is not surgery for those kinds of things. It is basically vocal rehabilitation, speech pathologists, and good, healthy habits, using the voice in healthy and non-abrasive ways. So it's good to be informed, but we're not able to make those sort of, judgment calls from the studio without the benefit of a scope and to be able to see inside. We can only guess so much at what may be happening. So that's a really good point. Yeah.
Excellent. So we have just a few minutes left here. And I was wondering if you could address, and I can address too, just there sometimes seems to be a dichotomy between what vocal teachers may teach and what choral directors may request of a singer. And in my opinion, it doesn't have to be that way, that we can all function and be, work together in this amazing effort to make vocal music beautiful, whether you're a singer or a choral director. And so can you talk a little bit about that, what you've seen from the vocal studio side?
Yeah, this is such an important topic, I think, especially in our current climate as musicians. With everything kind of suspended, it's hard to know what the future will look like for singers. Until there's a vaccine for COVID. But in the meantime, we can certainly address some of these issues that have kind of plagued us, as, these fights seemingly between choral areas and vocal area departments. I think it's completely unnecessary. I'm with you. I think it's such a waste of time. We are singers. We are all musicians. We shouldn't be battling about this. My personal opinion is that there is a way to do all kinds of singing healthily. Yes, they require individual sorts of training and specific adjustments to your vocal technique, conscious things that you do to find healthy ways to sing in different styles, be that jazz or R&B or blues or musical theater or opera, whatever the case may be. To me, the ideal singer should be able to sing healthily in all of those styles. Not necessarily be a specialist, but be able to healthily navigate those particular vocal styles. That's on us as singers. That's our responsibility. That's not our teacher's responsibility or our choral conductor's responsibility. That's us. We need to figure out how to do that. We're dealing with an instrument that no one else knows how to play, and no one else can see. So there's only one person who knows how to play your instrument. A lot of similarities between voices, but we really need to be responsible about that discussion. Definitely in the business, you hear a lot of discussion about, oh, well, it's because they've been singing in choir, their voice is trashed, and well, we're teaching you how to be a soloist, not an ensemble singer, and it seems that one is lesser somehow, and I just think that's nonsense, and it's incredibly damaging to what we do as vocalists. So that just needs to stop. So knock it off. We can be positive forces for that. We can definitely help people to understand that you can do so many things that are going to be the same in both of those situations, whether it be a small ensemble of, 16, or a larger ensemble of 200, or alone on the stage as a soloist. There are so many things that are the same about the way we produce sound. These little adjustments that we make can be done healthily. So first of all, I think we really need to realize that there's no such thing as, I'm going to train you like a soloist because that's healthy and that's the right way. And you're going to be an ensemble singer, so that's a lesser technique. That's just not true, and it's really damaging. The second thing is, as we're sitting in, those ensembles or switching between studios, you're going to have to make some of these key adjustments that we've been talking about today. It has to deal with breath levels, how much air is in the tone, what kind of resonance you're using. All those great rules of things that we learned in high school choir, like if you can't hear your neighbor, you're singing too loud. Yeah, that's true on the opera stage as well. If you're in a vocal ensemble and you're screaming away and you can't hear your colleagues, you're singing too loud. I'm usually one of the ones that can't be heard if somebody's singing too loud, but, so I have to work sometimes to bring it up a little bit, but you need to be a good citizen on stage in any scenario. So when you're thinking about projection, you can sing with great technique in a choral ensemble without having to worry about doing any damage. Look at your airflow. Look at your posture. Are you sitting up straight? Are you doing one of these? Because I've seen plenty of that, right? I've seen plenty of soloists go, well, I'm in choir. So you sit like that. Well, sit the right way and it might feel great, Or what I sometimes have my students do, if they're in a section and they're up on a really high note, for example, and they're supposed to be floating this note and not using vibrato or much vibrato. Well, that all has to do with air and core in the tone. I hope you're singing with core in your tone still, and I hope you're projecting in the right way. But if you need to be singing quieter, well, change your air pressure. See if you can focus in that tone a little bit more and get the same level of sound that you need, that your choral director will go, thank you, that's exactly what I need. But you're going to have to work harder to find the right balance of air. Is it harder work? Yeah. Will you be a better musician and a better singer for having discovered that in the practice room? Yeah. And will that enhance everything you're doing as a soloist? You bet. You bet it's going to make all that stuff easier, and it's going to make all that stuff more accessible. So the other thing is, look at today's climate, right? Look at the way that musicians are being trained, and look at the way that vocalists are finding work out in the field. You can't just go out and say, well, this is what I sing and that's all I sing, and so I'll just wait for the calls to start pouring in. No. I don't know if you find this to be true as well, Dr. Hale, but
Yes.
As a music professional, you have to be flexible. And if somebody says, we need this to happen, you got to figure it out. So you bet you're going to be singing different styles and conducting different styles. And you really need to learn your voice inside and out and learn what you need to be at top physical, healthy condition so that you can start to adopt some of these different stylistic elements that will allow you to be more flexible. The singer that can sing in a blues style, or go and sing happy birthday to somebody in an office party, or sing an opera gala, those are the singers that are going to work. Those are the singers that people want in their choirs and that want on the solo stage because they're flexible, they're adaptable, they're willing to learn. So just remember that those core components, those healthy components, they're all the same across the board. It's just a slightly different application of those fundamental principles that allow you to sing comfortably in a choir. Take your choir music to your teachers, please. I love it when my students come in with a piece from choir and they point up to a phrase and say, I can't sing this. I don't know how to sing this. And so either they end up screaming it at full blast or not singing at all. Any of you singers that have been in this boat know the frustration. You're thinking, I don't feel like I'm contributing to the group. I feel like I shouldn't be in there, and I feel like I'm not bringing anything to the table. So I've got to figure this out. But how often do we see students come into a voice lesson and bring those examples from this beautiful repertoire that they're working on? And how great is it when they leave with a strategy for how to sing that more healthily? Some more dramatic sopranos are in alto sections, right? Because their voices are such that they will stick out of the texture in a way that won't work for blend and is not conducive to a unified sound. So if you're singing alto as a dramatic soprano, well, take that stuff into your lesson. How great would it be if you develop some of those lower end notes, expand your range, find more consistency in your range, rather than saying, well, I'm not even in the right voice type. What am I doing here in the alto section? He doesn't know my voice. Yeah, he does know your voice. He or she knows your voice. You bet they do. And that's why you're where you are. So you don't blow your throat out. It's exactly what you're doing. So those kinds of things, talk to your choral director. Go in there and ask them. Our choral directors are fantastic singers. They're fantastic teachers, solo teachers, as well as choral teachers. Go say, can I sing this passage for you? And can you help me with some strategies, how I might negotiate this more healthily? I mean, I would venture to say that's something that you would welcome if I'm not off base, Dr. Hale.
No, absolutely. A little shout out to your colleague, Tucker Biddlecombe. He and I graduated from the same program at Florida State as well, and fantastic choral director, lots of high school experience before he went teaching college. And so I just said, what a great team you've got there at Vanderbilt. And I also want to give a shout out to your amazing wife, Valerie. I remember when I was in graduate school, Dr. Andre Thomas, amazing arranger of spirituals, amazing conductor, and actually, he'll be the president of the American Choral Directors Association in the next year. And he just taught me so many things. But what was amazing is Renee Fleming, a world-renowned soloist, came to Florida State and did a master class. And I remember him singling out Valerie because she was in choral rehearsal. She was giving her best. She was working hard. And she was about to go sing a master class for a world-renowned soloist. But she still was able to give in the different areas she was giving and just kind of back off where needed. And I think that's what a lot of singers, we just need to be able to adjust and be flexible, or we won't be able to have all of those different opportunities that come our way.
Yeah. Yes. Oh, thank you so much. And I had forgotten that, Roger. I'd completely forgotten about that. What a perfect example of somebody who is trying to be what I call, a fully functional vocalist. I mean, this is great. Knowing on stage and in the choral rehearsal when to back off, when to get the results that your conductor needs, but not at too high a price, spending too much vocal capital, putting yourself in a compromising situation. And we should be able to do those things with our voices. And what a tragedy if some of us were to miss out on that wonderful choral experience. I mean, there's nothing like making music in a choir. There just isn't. You're on stage, the opera stage, singing with an ensemble. That's amazing as well. These are all experiences that you can't really compare at face value. So how terrible that we miss out on some of these things. Why not experience them all with a healthy, functioning instrument that can do all those things, that has developed those skill sets, and can apply it to those different scenarios. I mean, I sang a few times with a wonderful little Baroque group out of Salt Lake, Utopia, and I learned so much about my voice by singing in those groups. I mean, sometimes 2 or 3 people in an ensemble, sometimes 5 or 6. You're very exposed. I mean, I could not make my voice do what it needed to do at first with those things. And I'm still working on it. We're always learning. But by being part of those small ensembles and singing that style of music, I learned so much about my voice, and I'm better for it today. I feel like I'm more flexible and more healthy. I was able to make those nasty sounds that we talked about at the first and totally fail. And thankfully, I was part of a group of singers that were absolutely understanding about that. They said, yeah, no worries. We know you'll figure it out. Here's what needs to happen. Here's where we need to line up. But in the meantime, we're going to give you your space to figure it out. And because of that, I've had the opportunity to sing that kind of music in recent years because I've had enough confidence to say, yeah, I think I could tackle that. Am I a Baroque specialist? No way. But do I love that music? And I didn't know I would love it? Yeah. Do I feel like I've cultivated a skill set that I would have never cultivated had I not tried it out? Absolutely. So I think to your point, this is so important to not put ourselves at odds with those various experiences. And just not even buy into that elitist attitude that somehow one use of the voice is superior to another. These are all intensely valuable skill sets, and today's musician has to have them, or you're not going to work. That's just how it is. So if you want to be out there working, great. And if you're not doing this for your living, for your profession and your livelihood, you're missing out if you don't experience the full range of what's available to us as vocalists. Doesn't mean you have to like every style, but you should be able to figure out a way to do it healthily, comfortably, sustainably. So.
Well, fantastic. Well, is there any final thoughts or any experience you want to share? I know that recently there was a rebroadcast. You sang as the tenor soloist with the Tabernacle Choir at Temple Square, previously known as the Mormon Tabernacle Choir. They didn't do the live performance because of the pandemic.
Right.
But it was so amazing to see you on there and, have that experience on that stage with that big choir behind you. What's it like to be in that setting with a full orchestra and that huge choir?
As you can see, I have a big stupid grin on my face because it is overwhelming. It's amazing. I had a quick funny story. I grew up watching the choir on TV. And my grandmother, actually, on my father's side, was a member of the choir for many years. And so, we grew up watching her, and that orchestra is just dynamite. They're just so talented, and they're so unified. And of course the choir sings with one voice. They're so streamlined. That rehearsal process is like nothing I've ever seen. It's so efficient and effective. And those people, you can just feel of the intensity and the passion that they sing with when you stand in front of them. And I got up there for the first rehearsal, this orchestral rehearsal. So the orchestra's there, the choir's there. And so all of a sudden I just realized that I'm standing in front of this choir and this fantastic orchestra. And it's a piece I've done a number of times. I'm no stranger to Messiah. I love the piece. But all of a sudden I just found myself getting caught up in sort of the gravity of it all and just being really overwhelmed. So my heart rate just started to skyrocket because all of a sudden I just got really nervous. I thought, I can't let these guys down. They're going to hear me open my mouth and say, whose idea was it to hire this weirdo, which happens all the time. And so I'm sitting there and I got ready, for my first entrance, because of course the tenor comes in on Comfort Ye in Every Valley, right at the beginning. And so I looked down at my watch to see my heart rate, and it was something around like mid 170s. It was just going, and I'm drenched in sweat. And I just thought, okay, you need to calm down, but I just looked behind me, and I see all these choir members they're grinning, and the orchestra is playing, and it's so beautiful. And I started on my song, and of course, I eventually calmed down. And then when they came in for their first number, I just remember sitting in my seat, having just my heart having just about exploded in my chest, and hearing them come in for that first number, just this overwhelming wash of sound and passion and feeling with that beautiful music. And I just sat there grinning. I just sat there with this big, stupid grin on my face. It was truly a transformative experience. It was so powerful. And, those music making experiences are those things you will never forget. And it's just a wash of sound and emotion coming over you, and you just get caught up in it. And it's hard to even put words to it, but most assuredly one of these highlights of my entire life, getting to experience that and in that beautiful building with that gorgeous music. It was tremendous. It was really, really a privilege.
Well, Tyler, it has been an absolute pleasure to have you on here. There have been so many wonderful comments. We've had people from Brazil, from oh my goodness. I could just scroll back here. I guess anyone could, to see where we have Quebec, Brazil. Oh, Wayne Jackson. That's our good friend Wayne,
hey.
One of Tyler's neighbors there.
Yes, sir.
So thank you. Cheryl Justin, been taking some group lessons, and my good old brother-in-law is on there too, Preston Reynolds. So
Fantastic.
Anyway, there's many of you. Really appreciate you getting on and listening today. And Tyler, thank you so much for your amazing positive attitude and your work. Please check out Tyler's information in the description below. I'm also going to put a link to that YouTube video, if it's still available, of him singing the Messiah with the other amazing soloists, the Tabernacle at Temple Square and Orchestra at Temple Square, and hope that you enjoy that. And please stay tuned. If you've not subscribed, please consider doing so. To my channel. I'll try to do more of these types of videos with other great singers and teachers out there. Anyway, happy singing. We'll talk to you later.
Thanks, everybody.
Thank you.